I'm a consultant in public health and I work in the City of London Corporation. We have responsibility as a corporation for both our resident population, which is around 7,000, and our city worker population, which is creeping now up to almost 400,000. Now that's quite a responsibility for any local authority to have that unusual population. So first of all, the challenge. What do we know about our worker population in the square mile? Since this study was done, the worker population has been creeping up, but what has remained the same is the culture. The culture is one of working hard and playing hard, and the city presents quite unique problems around both mental, physical health and substance abuse. So we did a small study and found that 78% of city workers said their work made them stressed. A large amount needed help for anxiety and depression, and almost a third were binge drinking once a week. Now, these levels are higher than the national worker population, and the city is quite a unique environment. But I think we need to remember, when we think about the city, it's not just about the high-earning, high-spending bankers. They represent a very small number of city workers. We need to think about the city is made of 98% of SMEs, small to medium-sized enterprises. We need to think about the cleaning staff, the auxiliary staff that help businesses work, and all of these people need to be taken into account. Over a quarter of city workers smoke. Now, the City of London is doing an awful lot to help city workers around quitting, and we provide a lot of smoking cessation services within the city. So we did another survey, and this was done in 2012, and you're welcome to read this report, showing again 44% of people said they were stressed at work. Alcohol was a big problem, and substance misuse, 10% of city workers said that was a problem. Now, that is quite unique to the city and actually quite difficult to tackle. Now, those numbers didn't seem to depend on private cover or whether they use the NHS. Using private cover is a proxy for those high-earning bankers. Other people obviously would use the NHS or have cover paid for them. It also didn't depend on their age, but women were more likely to be stressed, and were self-reported health was more likely to be fair or bad. So what did we do as a corporation? Well, we designed an organisation called Business Healthy, and you're all welcome to join it. It's free to join, businesshealthy.org. It's an initiative that's provided by the City of London Corporation, and it's aimed at city businesses. We run a range of activities. We have workshops. We have a website which has a members forum. We have literature and papers and evidence on our website that can all be used. And we use this forum as a central hub, as a resource. And we would like it to bring businesses together to have a chance to talk about workplace health. We have a growing number of members, and not all our members are from the City of London. You're most welcome to join if you're not City of London. We even have international members who are just interested in engaging in workplace health. So this is just the login page, just to show you how join for free is in the top right, and there's a forum, there's events that we put on, we have a blog, we have a regular newsletter, and we have resources. So I would encourage you to join to talk about workplace health. So what have we done so far? Well, we thought we would lead by example, and the City of London have completed the Healthy Workplace Charter, and you'll hear more about that from Charlotte later. We also won an award, a 3-year award in recognition of Business Healthy. We have a growing number of members, and we provide that practical support and help for businesses. And we also want to have a business case. It is cost effective to look after workplace, your workers in the workplace, and it is important to engage in that debate. So hopefully by using the website, people will have some help in taking it forward to talk about those issues, whether they be smoking, whether they be alcohol, substance misuse, or physical health. And I think they're real challenges in the workplace. Now, as a corporation, as I said, we do provide smoking cessation services. We also commission alcohol and substance misuse services. And while those not living in the city won't be entitled to use those services, what we do provide is our company, our commission service can go into any city businesses, can go into any health fairs to talk about substance misuse and alcohol. So that offer is available if you want to come to talk to me, and I'd be more than happy to put you in touch with WDP, our commission service.